Good medical morning. This is Watson, and today we're going to look at this enormous epidermoid cyst. Epidermoid cysts are rare, slow-growing, benign, developmental cysts which are derived from abnormally situated ectodermal tissue. Epidermoid cysts of the floor of the mouth represent less than 0.1% of all oral cysts. So far, only a few cases have been reported. In this case, we present a giant sublingual epidermoid cyst. The patient doesn't have any particular symptoms other than those related to its size. Accordingly, the cyst pushed the epiglottis posteriorly and created difficulty during intubation for surgery. Let's take a look at the scans of the object. A CT scan of the affected area showed a large, well-defined, thick-walled, peripherally enhancing cystic lesion, measuring about 10 by 8 centimeters in the midline submandibular region. Swelling was separate from all surrounding structures. No enlarged lymph nodes were seen. No bony erosion was observed. Neck vessels were normal. Parotid, thyroid, and left submandibular gland were normal, so that's good news. Other than the cyst, the patient's face and neck are somewhat normal. Let's look at the post-surgery images, and click like for the surgeon. Before I continue with the examination, please click subscribe and hit the notification bell for all our updates. Histopathological examination revealed a thick-walled cyst lined with a stratified squamous epithelium with acidophilic stratum corneum and basophilic dot-like staining of stratum granulosum, without any evidence of dermal appendages, confirming the diagnosis of epidermoid cyst. Clinically, epidermoid cysts are painless, slow-growing lesions with doughy consistency, often soft and well encapsulated. One of the biggest concerns in a surgery like this is keeping the airway open so the patient can breathe. In this case, tracheostomy was performed and the airway secured. The patient recovered well, and successful weaning of the tracheostomy was performed later on. Make sure to hit that subscribe button and the bell for notifications so you can keep up to date on all the interesting medical content out there. See you next time. When you just need more rest, there's Rest More. For better, more restful sleep, make it part of your nighttime routine.